The Trumpeter Community Health program in Juba, South Sudan, takes its name from Ezekiel chapter 33, where trumpets were blown to warn people of impending judgment. Sanitation advocates, supported by AID, are trumpeters, warning communities of the great danger of poor hygiene. Through group training and door-to-door visiting, they exhort wholesale behaviour change. Trumpeter Community Health is headed by Remijo on the left here. He leads a team of 30 sanitation advocates selected through local churches. The advocates focus their activities in 4 key areas. First, hygiene training, especially hand washing with soap. Here we see a group of children in Mori, a village on the banks of the Nile, being taught the basics by an advocate.
Now I'm going to start a demonstration how to wash the hand with soap. Okay.
The children then have a go themselves. The second area of focus is to reduce South Sudan's high rate of open defecation. At 63%, it's one of the highest in the world. And promote the use of latrines, building them where necessary. This is Godwill, a trumpeter group leader explaining the construction of a latrine in Kasaba.
They start with digging. They dig 3.5 meters. Then after digging, they put the aggregate and cement down there.
Let's meet one of the beneficiaries.
This is Polomena compound. She lost his brother and wife. There's 3 children, orphan. The trumpeter volunteers identify that this family is needed family. Then we got the money and we support them with the latrine there.
She then shows us the finished unit.
Yeah, the latrine is well equipped and clean. It is very nice.
The third area of trumpeter activity is to improve access to clean water. Here, Remijo draws water from the only borehole in Mori, a village of over 6,000 inhabitants. Boreholes are in constant use, and pumps, like this one, are often worn out, yielding a weak water supply. Trumpeter teams identifying broken boreholes, repair them where they can, and facilitate major restoration by NGO partners. Trumpeter teams also recommend the drilling of new boreholes like this one, and the Juba Diocese hopes to commission their own boreholes in the future. The final focus of trumpeter activity is running diarrhea and cholera prevention programs. This involves visiting folk in their communities, explaining the issues, providing water purification tablets, and practical advice for mothers with young children. We are pleased to report that over the past 3 years, there have been no incidents of cholera in any trumpeter area.